Well, hair transplants began with plug transplants, where the doctor would excise plugs from the back of the scalp and put them to the front of the scalp. These were big plugs. We still see them on the street today. And then over time, those were refined into follicular units. And instead of taking a plug out of the back of the scalp, a strip of skin was removed out of the back of the scalp. And then those were dissected first without microscopes, then with microscopes, into follicular units, which is either 1, 2, or 3 hairs, much smaller than what we see with plugs. The problem with that surgery is that it left a linear scar in the back of the scalp. So the procedure evolved further into what we have now, which is follicular unit extraction, which is taking one follicular unit out at a time, which leaves no noticeable scar, no linear scar in the back of the scalp. You can cut your hair as short as you want. You don't have to hide anything in the back of the scalp. And with patients wanting to wear their hair shorter these days, that has become much more preferable.